Hi, I'm Dr. Kevin Casey. I'm happy to welcome you again to the second episode of Cooking with Casey. Today's episode I have with me Dustin Riccio. Dustin is an emergency room trained physician. He is president of our Eastern Region hospitals, Newark, Wayne, and Clifton Springs Hospital.
Correct.
And happy to have you here. So talk to me a little bit about what happened in the emergency room with flu this season and what we typically see.
Yeah, so the flu this season was actually quite difficult for all the emergency departments, and I think that's when we see the individuals actually coming in. And then when we get into the mail, we talk about the man cold, right? And so in addition to the flu-like symptoms, we had a really brutal flu year. We also had a lot of man cold coming through. And I think, you know, when you start to separate out men versus women, you know, that is one of those things that we joke about, but we do see it.
What is the number one thing that seems to bring people into the emergency room?
You know, I know we're talking somewhat about men's health, but men's health and women's health, that number one killer still remains the same. Heart disease is the same across in our emergency departments as well as the number one killer in the United States, and that would play true within Rochester Regional Health as well.
In our last episode, we talked about men's health and how men often delay their presentations and delay getting health care. Does that affect you in the emergency room as well?
Yeah, I think it does. I mean, you know, women will typically present later with that chest pain and shortness of breath kind of symptoms because it comes on differently for them. Men will present with chest pain and shortness of breath, and they typically will come in an appropriate fashion.
Other things that you see on that acute side, on the more critical kind of things.
Yeah, you know, and I would put abdominal pain as one of those things that we see in the emergency department all the time, and it is, again, it is not gender specific. Abdominal pain is the same across men and women, and it is one of those top 5 chief complaints that we see all the time. From most life-threatening to least life-threatening is those weekend warriors. So I don't know if you know what that means, Kevin.
Yeah.
Oh,
you're
one of them?
We've all been there.
I got it. So those weekend warriors, those are the guys like myself who are unable to exercise because of work restrictions, family, going home and life. Thank you very much. And then they get some time off on the weekend and they decide that they're going to run a half marathon or a full marathon or play a pickup game with a bunch of 18-year-olds. And that is when we start to see those kind of bumps and bruises. Those are from the weekend warrior.
Dustin, thank you very much for coming out here.
Thanks for having me, Kevin.
It's great to have you, and I've really enjoyed this. Our food looks like it's ready to go.
Yeah, so with that, Kevin, who I'd like to introduce to you is Hannah. Hannah's a registered dietitian at Newark, Wayne, and Clifton Springs across the Eastern region. And what does she have for us today?
So in complement to our chicken wing burgers, we also have a homemade low-fat yogurt and blue cheese dressing, and some fresh kale and a tomato on there. And it looks like it'll be an absolutely fabulous lunch for us.
It will.
Want to make the point for folks, if they have an acute injury,
come to the emergency department. We're there for you.
Excellent. Thank you for coming and watching us today on Cooking with Casey, our second episode. Watch for future episodes as we release them.